Hi friends, welcome to the SPOTTERZ series. Now look at this particular image. This is an intravenous urography. So what is this image? This is a intravenous urography image where contrast has been injected intravenously. And as you can see here, what are the findings here? You're able to see the urinary bladder. Just carefully pay attention to both of these ureters. So what you can see in this particular image, let us use the magic view graphic. So what you can see here is the urinary bladder, and over here is the right distal ureter. The right distal ureter appears normal, but if you look at the left ureter throughout its course is appearing to be dilated. Why so? Look at the terminal end of the ureter. What do you see at the terminal end of the ureter is a cyst-like dilatation involving the ureter. So a cyst, in descriptive terms, it is called as a seal. It is involving the ureter. So what is your diagnosis? The diagnosis here therefore is, yes, ureterocele. So what we are looking at is a ureterocele, and this appearance, this bulbous expansion at the distal end of the ureter, that is where the cyst-like dilatation is, this appearance is called as, yes, the Cobra Head appearance or adder head appearance, or yes, anyone, this is also called as the spring onion appearance, right? And this can give rise to recurrent UTI in a child. This is a congenital malformation. One very important thing about this particular halo that you see around that particular seal, if I remove the graphics, this halo that you see around the ureterocele, this needs to be a very, very smooth halo. If you ever find that in an adult patient, you see a finding like this and the halo is a very irregular halo, then it could mean that there is a tumor there, and then this particular appearance or this condition is what is called as the pseudo ureterocele, because it looks like a ureterocele but the underlying cause is basically a tumor there. This will give rise to a very irregular halo around it. Yes, so this is what is the magic view graphics appearance of a pseudo ureterocele or a ureterocele. Yes, that is what we have discussed. Now look at this IVU image. Now this topic, remember, of conventional modalities in genitourinary tract and GIT, this is an absolute favorite of your examiners, and therefore a lot of questions are asked in your exams very frequently on these particular topics. So let us quickly look at some important spotters related to the genitourinary tract, mainly the renal system. Now look at this normal IVU. Look at the graphics there. Can you see magic view graphics there? These are the renal shadows. These are the pelvicalyceal systems and the urinary bladder. That is how the kidneys look like. Do you notice something strange here? What is strange here is that the left kidney is not visualized in the left renal fossa. However, right, what we are able to see here is that both the kidneys, the left kidney has actually crossed over across the midline to the right side. It is fused with the normal right kidney, right? And then the ureters that begin from each of these kidneys, the left ureter actually crosses over to the primary left side and then opens into the urinary bladder. So this is what is called as a cross-fused ectopic left kidney. So this is a cross-fused ectopic left kidney because it is the left kidney which has crossed over to the midline. It is ectopic in location. It is fused with the normal right kidney there. So this is cross-fused ectopic left kidney in this image here. Now see here, what do you see in this particular image? In this image, you can see on the left side a single pelvicalyceal system, a single ureter opening into the urinary bladder. Can you notice something different on the right side? What is different on the right is that there are two pelvicalyceal systems giving rise to two separate ureters which are draining into the urinary bladder. So when you see two separate pelvicalyceal systems, this is what is called as a duplex pelvicalyceal system. The clinical importance of duplex pelvicalyceal system is something that you must have studied in surgery. Let us quickly revise it. If you remember, it is what is called as the Wiegert-Mayer law. The Wiegert-Mayer law tells us each of these ureter or moiety or entity as it is called is predisposed to certain abnormalities. So the upper moiety, that is the upper entity, that is the upper ureter, that is this ureter, remember it U, me, U. So U stands for upper. It is inserted where? It is inserted more medially and inferiorly to the trigone of the urinary bladder. So it is inserted more medially and inferiorly to the trigone in the urinary bladder, and this second U means it is more predisposed to the development of ureterocele. So it is more prone to the development of ureterocele. So upper medial inferior insertion on the trigone, and it is predisposed to ureterocele. Remember lower moiety or lower entity, remember it, lower lax reflux, remember it this way. So the lower ureter or lower entity has a more lax or a more loose insertion on the urine into the urinary bladder, and therefore because it is a lax or loose insertion, it is more prone to the development of reflux. What is reflux? The urine goes back from the bladder into the ureter. So this is what is called as the vesico-ureteric reflux. Ureteric reflux. So vesico-ureteric reflux. So U upper moiety medial inferior insertion predisposed to ureterocele, lower lax reflux, lower ureter has a lax or a loose insertion, therefore it is more predisposed to vesico-ureteric reflux. A named sign that has been asked in one of the exams before is what is called as the drooping lily sign. So look at the left pelvicalyceal system, looks normal in the appearance. On the right, the lower pelvicalyceal system is drooping down. Why? Because something is pushing it down. So this is what is called as the drooping lily sign. So this is called as the drooping lily sign. And why is the lily drooping? Because something is pushing it down. It is seen in a duplex calyceal system with a obstructed, dilated upper system. So here in this IVU, the upper system is not seen. Why is it not seen? Because it is obstructed, it is not excreting contrast, and it is dilated. So because it is dilated, what it is doing to the lower pelvicalyceal system, it is pushing it down, and that is the reason why the lily appears to be drooping here. This is called drooping lily sign, seen in a duplex pelvicalyceal system with an obstructed or dilated upper system. That is what is your drooping lily sign. Now here, look at this particular patient. On the right side, so intermittently this patient has left-sided lumbar pain. On the right side, the pelvicalyceal system and ureter is normal. What do you notice on the left side? There is hydronephrosis. So there is dilatation of the pelvicalyceal system. This was a recently asked question. But why is there dilatation? It is because, see, the renal pelvis here. So this is the renal pelvis. This is also massively dilated. There is an abrupt cutoff over here. The ureter is not dilated at all, not opacified. Why? Because this site is the site of obstruction. What is this site? It is the junction of pelvis and the ureter. So this is called pelviureteric junction obstruction or PUJ obstruction, where you will see that the ureter is not opacified, it is not dilated, but there is a ballooning of the pelvis, renal pelvis along with hydronephrosis. This is pelviureteric junction obstruction or PUJ obstruction that is seen here. Yes. Diuretic renography is something which is used to distinguish between an extrarenal pelvis which is not obstructed but a PUJ obstruction. In PUJ obstruction there is going to be a genuine obstruction. So when you inject diuretic in extrarenal pelvis, all the contrast will be washed out. It will come into the ureter because there is no obstruction there. But in PUJ obstruction, right, because there is an actual block at the pelviureteric junction here, it will give rise to further ballooning or dilatation of the renal pelvis and ureter. That is how diuretic renography can be used to distinguish between a extrarenal pelvis, which is like an anatomic variant, versus PUJ obstruction, in which there is real obstruction at the pelvis and ureteric junction. Yes. Now look at the course of the ureter here. It is strange. This is called as a J-shaped ureter or a fish hook ureter. So what you see here basically is that the ureter in such cases over here is actually hooked behind the inferior vena cava or IVC, and it creates a compression at that particular crossover site. So you can see proximal to the crossover, the system is dilated. There is hydronephrosis. This is what is called as a retrocaval ureter. Because IVC is on the right side, a retrocaval ureter giving rise to a fish hook appearance or a J-shaped ureter. It only occurs on the right side, involving the right ureter. This is not an anomaly involving the ureter, remember. It is a variant in the development of the IVC embryologically, and that is what the course of the ureter becomes such. This gives rise to the fish hook appearance or the J-shaped appearance of the ureter. In the retrocaval, as you can see in this image here, the ureter is actually passing behind the inferior vena cava. Yes. Remember friends, in these small sessions, we are going to add on to your knowledge base. We are going to create these new circuits in your brain. We are going to refresh them, right? Why? Because these small steps of improvement are going to help you immensely in your exam. right? I want you to go through these particular sessions in a very short period of time. They are going to give you a very high yield. If you never try, you never know, right? Who knows, you'll get a great rank in this particular exam and get your dream branch of your choice. So let's rock this exam together. Thank you.